And we're joined today now by Dr. Divi Cornec. He is with the Mayo Clinic in Rochester, Minnesota, currently studying about ANCA vasculitis and currently doing a funded study there. So Dr. Cornec, thank you so much for joining us today. Tell us first off a little bit about this study and what all you're currently doing.
Yeah, hi. Thank you very much for welcoming me here. So my name is Divi Cornec. I'm actually a rheumatologist in Brest, in the west of France, but I'm currently working with Dr. Specs here at the clinic in Rochester, Minnesota. The grant from the Vasculitis Foundation we just got is a fantastic opportunity for us and will allow us to complete our research project. So I take the chance of this interview to express all my gratitude to the Vasculitis Foundation. Many studies have already characterized those autoantibodies, the ANCA, but until now, very little is known about the differences between normal protective B cells and abnormal ANCA-producing B cells. So our current research here has two major aims. The first aim of our project is to develop a method to recognize those abnormal B cells among all the other normal B cells in the blood of patients with ANCA vasculitis, and to study if their proportion is associated with disease activity and could even predict relapses in patients who are in remission. If this is the case, this test could be very useful to guide the treatment for each patient. We have received funding from the Vasculitis Foundation to complete the first aim during this current year. And the second aim of our study will be to study in detail the characteristics of these abnormal B cells, which are associated with the disease, to try to understand what are their main differences from normal protective B cells, in the hope of discovering specific features that future treatments could target to destroy the abnormal cells, but not the normal protective B cells. We also submitted an abstract to present our results at the next European Congress of Rheumatology, the EULAR conference in Spain next June. And so those first data validated our method to recognize those abnormal autoimmune B cells in patients. And we also observed that they are more frequent in patients who have an active disease compared to patients who are in remission. So we are now working on samples from patients included in the RAVE study to confirm these results in a much larger population.
Great, Dr. Cornec. Thank you so much again for joining us, and best of luck here with the rest of your study.
Thank you very much.